Do we have to go through the introductions again this time round?
I think that's a good idea. So it should be showing that you're live very soon, if not now.
Saying on my screen, you're live on YouTube.
Yeah, so does mine.
Okay. Okay. Well, thank you and good evening and welcome to Council and Staff Joint Trade Union Committee. My name is Sukhminder Kausi, Chair of Trade Union Side. Do you want to introduce yourselves now? Shall I go through the list? Mary?
Mary Lancaster, Unison.
Julian?
Councillor Julian Bell, Leader of the Council.
Adam?
Adam Smith, Unison.
Thank you. Steve?
Councillor Steve Donnelly.
Thank you. Yvonne?
Councillor Yvonne Johnson.
Thank you. Liz?
Liz Charles, Director of HR Ealing.
Thank you. Bassam?
Councillor Bassam Mahfouz, Cabinet Member for Leisure and Finance.
Thank you. And we've also got Keith, who's Committee Clerk. So thank you. Can I suggest in terms of the agenda that we combine some of the items together so we can get through it more efficiently? So under item 8 of the main agenda, can we combine it with item 5 of the trade union side, which is it all falls under workforce equality update? And under item 9, health and safety, can we take it with item 6 of the trade union side? And can we encompass this item to be health and safety update, well-being update as well? So that will put it under one umbrella, if that's agreed. Good. I've seen heads nodding. Okay, right. In terms of urgent matters, I don't think that any urgent matters come to us. Declaration of interest, I'm assuming you have no declarations to make. No, I see heads shaking, and there are no matters to be considered in private. So can we go through the minutes of last meeting? So I'll take them page by page. So page 5 of the agenda, which is page 1 of the minutes. Any items? Page 2. Obviously, in terms of item 5, the Ethical Care Charter, would like to have an update in terms of this. I know we said we'd keep it on the committee agenda, but we'd really like to have a timetable by when this is going to be done by, because you've agreed it in principle. It's about the implementation, which is really important, particularly in today's COVID world, where we've got a lot of care workers who are out there on the front line, putting their lives on the line, and they really do need to be recognised and being paid accordingly. Don't know which one of the councillors wants to pick up on this.
Yeah,
Julian?
I'm happy to, Sukhminder. Obviously, we've done some of the work that we talked about in terms of looking at what would need to happen in order to implement the Ethical Care Charter. We're only partially through it though, and there needs to be some more market engagement. And the problem we've got is that everybody's all hands to the pump dealing with COVID at the moment. So I think realistically, we're not going to be able to do that market engagement until we get some return to normality. But obviously, I hear everything that you're saying in terms of the efforts and risks that carers are taking in order to provide their work. And we all went out and clapped on our front doorsteps every Thursday and realised that there needs to be a new kind of value put on the work by our carers. So it's something that we as the politicians are very keen to push forward as quickly as we can.
The question is when.
Yeah, well, and I knew you were going to say that. That's a minute. And you know, we're all subject to the kind of vagaries of COVID and second and third waves and new variants, and it's been very, very difficult to predict what's happening. So I would hope that we're going to be starting to get some kind of normalcy back by the summer, and we'd be able to get on with that work by then. But I honestly can't predict, because it's as we've seen, quite unpredictable.
Okay, I'm obviously going to push you on this, because I'd like you to put out a statement that this is what you're going to do. Julian.
Yeah. Can I talk with officers in terms of what I don't know if anybody else wants to come in on what realistically might be a timetable, but I think if we go back to adults and see if they can give us any more clarity on what a timetable might be, then that might help us provide what you're asking for.
Well, I guess what I'm asking for is a statement that this is what's going to happen when time permits. That this is what the council is going to do, is what I'm after. So it's a public statement. It's not actually pushing for implementation as quickly as possible, although we'd like it. But it's a statement of intent that this is actually going to happen.
I believe, Sigmund, that we've already done that. If I'm not correct, if I'm correct in remembering properly, I believe that we did that in I think it was actually something like a joint press release or joint thing that we put out on it. But if not, then I can go back through the archives. But I thought we were pretty clear about.
Yeah, that would be really helpful. Thank you, Bassam, if you were to go through the archives. But if that statement hasn't gone out, then let's make it go out. That's what I'm asking for, and I think that's a very reasonable request.
Yeah,
but I would think
let's come back to you on that in terms of we'll do that.
Okay, and I know in the minutes it says that Julian and I would meet, but which we didn't meet. But I'm sure we'll meet in the next week or so. Mary, you've got your hand up.
Yeah, I just would be interested for is the Labour group thinking that you would have that clearly as part of your manifesto going forward, that is a clear definition that you are going to improve the working conditions and rates of pay for a substantial part of your workforce, indirect workforce, who are ignored from a financial point of view, and their conditions of service are appalling. So I don't think that you have indicated that before, Basim, in a 100% way that you will definitely implement something. We've talked about it, and we've talked about that we know it's going to cost money and things like that. And we've also talked about, well, we don't want you to do things half-heartedly. We don't want you to take the credit that you've signed up to an agreement and then not actually do anything about it, which I know we have lots of other London authorities and authorities across the country are doing, and they're getting challenged for that. And that wouldn't be good for us. But we do need, to see something that you actually do mean that you're going to do something about it, and not just wait for us to bring it up again 3 months later.
I mean, I think as Gillian's pointed out, and you will all appreciate, given that you work so closely with and are on the front line, this is these are just such difficult times for all of our staff, and actually people trying to throw the definition of critical worker when actually I think every single council worker is a critical worker at the moment, and I think that's right, that's the definition actually, because we are on that front line tackling this deadly pandemic, and it's now horrifically, and it's absolute worst, even worse than it was, you know, what we thought was the peak last year. And I completely appreciate that, you know, the people, those people that we're talking about now, their work is absolutely you know, phenomenal in terms of what they do on a day-to-day basis, and you know, means so much. So we'll put out what we've already said for you to share that with you, but you'll also appreciate that clearly, you know, there's been a hell of a lot that we've had to put, you know, had to be put on the side and so on as we've been tackling head on the challenges that this pandemic has thrown at us. And of course, right now, when we thought we would be over the worst of it, we're actually in even worse depths. And you know, 2021 is so far worse than 2020 was, and what we could have expected from it. So you'll appreciate that has got to be absolutely the focus that we've got at the moment. But you have that commitment from us in terms of as a Labour group, and I mean, obviously beyond us to be able to say what will be in our manifesto for next time around. But you've also seen us put into practice the improvement of staff salaries and staff terms and conditions, for example, around the environmental services contract. And that has come at cost, and but yet we have done that because that was the right thing to do, and we've implemented it. So we've got not only the words, but we've got the track record of actually delivering on those sorts of things. So I think what you've got in us is is a group who are committed to doing this. And yes, you'll appreciate that clearly right now, very, very difficult times, but we'll pull out what we've committed to already, and we'll share that with you guys so that you've got that clarity.
Okay, and I'll chase Julian up in the next couple of weeks to see progress and to feedback. Should we move on to page 7 of the minutes? Is there anything? Page 8, 9, page 10, page 11.
Did you want me to comment on wellbeing concerns now, or shall we wait and do wellbeing as part of the agenda?
On the main agenda, yeah.
Okay.
That'll be helpful. Thank you. Page 12, page 13. On page 14, if I can jump in here, is we had a discussion about the new appraisal system, which we've been consulted upon. But we were going to have a discussion in terms of recommending that the same appraisal scheme to schools, and we've yet to have a meeting to discuss that, Liz.
Yeah, so if I can just give a quick update there. So we've met, I know you've had a briefing yourselves on the performance appraisal system as union colleagues, and Mark Nelson, head of HR Schools Consultancy, and Andrew and I have met, and Mark is going to take the documents and the briefing that we've done to the group that they hold, which is basically a number of head teachers that meet with HR Consultancy. So he's going to have an initial discussion with them on the next agenda, I understand, and then sort of gauge some interest, and they'll go back to their quadrants and talk to the other head teachers. And then obviously we'll arrange a meeting with yourselves, and including Danny, to talk about whether or not that's something they showed any interest in. So we're going to share all the information with them, have that initial discussion, and then we'll have a wider meeting.
I think, Liz, and thank you for that update, but I think if we can commend it to schools, then that will be more positive, than rather than, just give them a choice. If we commend it to them, then they can have a more informed discussion with us as well about this.
Yeah. Yep. So the approach we talked about was that they might like to use some of it. We can commend the whole thing, but they might say, well, we've got some of it that we already do. So that was the conversation Mark's going to have with the head teachers.
Okay, great, and we'll wait.
And he's a big supporter of it. Yeah, and Mark himself and the schools team are a good support for it.
Right. Okay, great. So that's the end of the minutes, and we can approve them as correct record. And we'll move on to the employee side items, and the first one up is business as usual services being provided directly by the council. Should we take items 1 and 2 together because it's all interrelated? And it's basically to get an overview from you councillors in terms of, now we're in the 3rd lockdown, the figures are going through the roof, and alarmingly so in terms of transmission rates, number of deaths across London and across the country, and particularly in Ealing. It's just a very worrying and frightening place to be, and it's really what we're doing as a council. So it'd be helpful to get from you, Julian, an overview of the strategy and the thinking and any plans that you have.
Yeah, and you rightly point out, Sukhminder, that we're in a pretty tough position at the moment. We've been continuing to see our cases go up. We passed over the 1,000 cases per 100,000 population over the weekend, and it's continued to rise until today. Actually, today's the first day that it's actually gone down. So our high point, and these are rolling 7-day averages, which are delayed by a couple of days. So for the weekend in the 8th of January, our rolling average was 1,135, I think it was. That was yesterday, and today it's gone back under 1,100. But actually, in comparison to others, we're still going up that table of boroughs in terms of numbers of COVID cases. So if you remember back before Christmas, we were around 28 in the borough rankings. We're now 8th, and yeah, we've been over 1,000 for a little while, which is really concerning because death rates are also going up. Admissions to hospital are going up, and we have had the mayor declare a major incident last Friday. I made a call out to faith leaders to close places of worship voluntarily because the government had not asked them to do that. I do think there's more that can be done, and that's why I made that call. And the vast majority of places of worship and faith groups have heeded that call and have closed. For many of both group worship and collective worship and private prayer, and some of them, and most of them, for certainly collective worship. In terms of what we've been doing, we've now got 6 lateral flow rapid testing sites that we've opened as of this Monday lunchtime just gone. They are targeted on those parts of the borough where those more vulnerable people are in the borough, where there is more likely to be susceptibility to COVID. So we've got one at Central Manor House, one at Greenford Library, Northolt Library, Acton Town Hall, in the Everyone Active centre there, and we've also got one at Central Library in Ealing, and we've just in the last couple of days opened Percival House. It was originally for staff and their families. It's now open to the public as well. So we've got 6 of these testing centres for rapid tests. You get it in less than 30 minutes, and it picks up people who are asymptomatic. If you have the symptoms, you should still go to the regular PCR testing sites that we've got in the borough and follow the NHS booking process. And all of those things, we've upped our rates of symptomatic so that we're over 600 tests per 100,000 of population. We're doing significant amounts of testing. We've got a very high positivity rate. It's about 27. You have a problem if your positivity rate's over 3, and we're on 27. So that indicates the gravity of the situation. In addition to those testing sites, we're working very, very hard with our NHS colleagues to roll out the vaccine. We've had about 5,000 residents who have so far received the vaccine. It's the Pfizer one. It's the more difficult one to store because it has to be stored at -70. But that's been rolled out to our over 80 vulnerable residents and also frontline health and care workers. And we're also rolling it out to residents in care homes as well. We've got 2 vaccination centres at the moment, one in Southall, one in Ealing. We're looking to open one up in the north of the borough. And then at the beginning of February, we're also looking to open a mass vaccination centre, which will be in Ealing. And when we get that up and running, we'll give details of that through our communications channels. But we've been working hard to get vaccines. The Oxford AstraZeneca vaccine will start to receive that next week, and that will substantially increase the amount of supply of vaccine that we've got, because it primarily is the supply of vaccine that's holding back rolling out the numbers. So we'll see increased numbers of people being vaccinated next week, but I'm still pushing for a site in order to increase the amount of vaccinations that we can get out. And I think I'll stop there, so I'm going to take any questions.
Thank you. Julian, your audio, when you're speaking, it cuts in and out, so I don't know if you've got an issue with your device. But Adam, you've been very patient, so would you like to go ahead?
Second minute, it's Keith. Could I just stop you a minute? Somebody's in the waiting room, but I don't know who they are. Are we expecting?
Is it Colded Man?
I don't know. I've asked them to identify themselves and they haven't.
Yeah.
So shall I let them in? I can remove them.
And then you can.
Okay. Right.
Okay. Great. Sorry, Adam. Would you like to go ahead?
Yeah. Obviously, in the longer term, the vaccine will be a big part of moving things forward. But in the short term, one of the biggest issues, it seems, is that self-isolation payments. Because compliance in the general community seems to be 80–90%, but for those being asked to self-isolate, it's only reported to be about 30%. And I know everything has been thrown at the benefit service, the local welfare assistance team, in terms of, whether it's vouchers for schools, whatever comes, and obviously self-isolation payments have gone through the roof in the last few weeks because the infection rate has gone up so high. And if you're not paying people the money within 14 days, then it seems fairly pointless having a self-isolation payment service. So we really need to provide the council the support and resources to the local welfare assistance team, and look potentially at not just using that team, but using other teams in the council with the an experience to make these payments out to the individuals that have been asked to self-isolate. Otherwise, it's self-defeating. We're going to see infection rates continue much higher in the borough than they should be.
Do you want to respond, Julian?
Yeah, my mute button.
Sorry.
Absolutely take on board what you're saying, Adam. We, along with the mayor and all of London's council's leaders, actually, we've consistently been asking the government to address this problem of isolation payments. They're not enough. People are not complying. costs, they're not enough. The calls that we've been making are about actually, as a minimum, having them at statutory sick pay levels. So we will continue to ask every time we communicate with government, every time we have London Council leaders meetings, we reiterate all of these points, but I'm afraid it's fallen on deaf ears. But we will keep asking, because it's absolutely critical that people are given the financial resource to
Absolutely. Mary. Sorry, was that you, Bassam?
Oh, yeah. Sorry, just to add very quickly,
Yeah.
I guess. I thought, when we were given the task to do it in the first place, I thought it was just absolutely bonkers that the government would expect us to do it, because actually, the local welfare assistance team is already doing a phenomenal job to try and support lots of people during this time. We don't have the information to make the decision in the first place. We have to request that from the applicant and then double check it. Whereas if the JCP DWP did it, they know that those people are on the right benefits. If it went through the employer could actually furlough them now far more flexibly, and at no cost to themselves. That person could get 80% of their salary for the 2 weeks or 4 weeks, the length of time they needed to self-isolate, and it would be zero bureaucracy to any additional bureaucracy. It's just an absolutely pathetic system that they've set up for it, which is just a completely knee-jerk reaction and just does not make any sense. I don't know who determined that was a good idea in the first place, but clearly doesn't work.
Thank you, Mary.
I'm going to make a more significant point a bit later on around how some of these issues around self-isolation and things are working within ELIM. And the knock-on of them. But actually, I was interested just on the vaccines, Julian. Do we know how many staff have taken it up? So how many frontline social care staff have taken it up? And then as a sub thing of that, how many of them are directly employed by the council? Because that's a big frustration for us, but we don't think that our staff, because we don't have a tremendous amount of directly employed traditional frontline social care staff within the council, our frontline staff are kind of being a bit further down the list. And as Bassam said earlier, nearly every local government officer could be classed as a critical worker, and a vast majority of them can be classed as frontline workers. So, we've got the sheltered housing officers who are still offering a limited service and are having to go into people's properties. They won't show up on those social care lists. So their chance of a vaccine, it appears to be a long way off, unless ELIM says these are social care staff and we start to move this forward, because the staff are starting to feel really frustrated by that. They're starting to say, you're expecting me to go out, but you're not fighting my battle to get a vaccine. And the government's just being very dismissive about who's getting it and who's not getting it. And I think that locally we need to start being stronger about who we think should be getting those vaccines and making sure that as staff are getting them, because I don't see LBE staff being prioritised as quickly as they could be.
Thanks, Mary. In terms of where we are with vaccines, I don't have any greater breakdown than that 5,000 figures, and I've only had that 5,000 figure in the last couple of days. I assume that in time we will get more of a breakdown. So obviously I'll be interested, as you will be, in who is actually getting the vaccine. The other positive thing to report is that we have not wasted any vaccines so far. So unfortunately, you always have a number of no-shows in a day's work to get out the vaccine, but and the storage time and ability for the vaccine to continue to work is time limited, and so the centres have got a system whereby, according again to the priority list, they will call people in at the end of the day and make sure that they use those no-show vaccines that are left, and that's the Pfizer ones. Obviously, when we have the Oxford AstraZeneca one, that problem will be lessened. But at the moment, it is those. So, for example, my GP was one of those that was called in as a no-show late on a Saturday night vaccination. So I think it is those it's health and care frontline staff that are getting it at the moment. Clearly, all of those points that you're making, Mary, we've been making them in our representations at London Council's level to government, because they're the ones who are determining the priority lists, and so we've been lobbying to include council frontline workers. One particular challenge at the moment is and it's worse in some parts of the capital than others, is that refuse workers have got COVID, and so there's a case for ensuring that their priority is increased, because if you don't get your bins collected, we'll have a whole host of other problems. So we're alive to those problems. The critical thing is to get more supply of vaccine. There was an issue where the vaccines were just being given out according to one kind of pizza box of 975 Pfizer vaccines to each primary care network vaccine centre, and it didn't actually relate to how many patients each of those primary care networks had. And obviously urban settings have got far more patients in those primary care networks than other parts of the country. So you'll have seen today that London is behind some of the other regions. Now, part of the reason for that is because centrally we've not been given enough vaccine. We've just been, according to our needs, we've just been given a pizza box of vaccines per primary care network. That is because of the lobbying that we've done, that has changed now. And so that's why we're going to get more vaccines next week, because they'll come to us because of our need and the numbers of people that we've got in each primary care network. So I'm hopeful that things will improve, and that if we can get a second mass testing site, that in February we'll be able to get down those priority lists, and council workers will be in that list of people getting them.
Well, can I jump in and say that we're aware that Judith's people are doing a list for frontline workers within the council in terms of social workers, children's adults, and others. But what we've been lobbying for is for other directorates who have been left off of that list, which include people and groups of workers such as care line, sheltered housing officers, mental health link officers, and mental health social workers, because obviously we work with West London Mental Health. They're receiving the vaccination, where our people who are going out to do reviews and potential sectioning of individuals are going into people's houses, and they are, it's a duplicity if they're not receiving it, but their colleagues within West London Mental Health are receiving it. So we really do need to prioritise a lot of council officers to be higher up on the list and to get the vaccination ASAP.
If you want to share with me your kind of priority lists and those members of staff that you've just talked about, then I'm very happy to argue and push to make sure that they're included if possible.
And I'd also include schools-based staff as well, which because they're still going into and they've got a number of issues. But we'll come back to that item, the next item after item 3. But I think from you, Julian, I'm trying to look at the strategy in terms of what we're doing in terms of council services, because we were doing recovery. We've halted recovery as the confirmation I'm looking from you. And what's the plans in terms of potentially rowing back or doing things differently? I just want to hear from you.
Yeah, so clearly we've had to pivot towards response to the virus with the second variant and the increased numbers. So, using our library buildings for our lateral flow rapid testing centres is probably the best example of how we've moved from recovery to response to the virus again. And clearly, the priority right now is to get this vaccine out and to help our NHS partners. They're doing this, but we're all levels, at Ealing level, Northwest London, London level, local authorities are saying to the NHS, how can we help you? How, are there administrative tasks that we can take off you to help? We've already seconded some of our staff to work with the CCG in order to help them to get this vaccine out, because that is the number one priority. So things I think will continue in that vein until we move beyond this current lockdown crisis that we're in, and a substantial part of the vaccination program has been completed. So so that doesn't mean we're going to start reopening services and pivoting back to that. No, we've got to review, I think, all business, and I've had conversations with Paul Nassar, the Chief Executive, about reviewing kind of business as usual to see if there are things that we could stop doing in order to free up more resource to help with vaccination and asymptomatic testing and our response to COVID.
Okay, thank you. Mary, you've still got your hand up. Was that a legacy hand or did you want to come in?
It's a legacy hand, yeah. No, sorry.
Okay, right. Thank you. Have we concluded on items 1 and 2? If that's okay, we'll move on to item 3, which is
Chair.
Chair. Yes.
Sorry.
Yes. Sorry, Keith.
It's just I wonder if the person who's joined could identify themselves, please. There's a
hello.
It's Mark Reynolds.
Oh, is it Mark Reynolds? Okay.
I'm going to change your name to Mark Reynolds then from the long. Okay.
Welcome, Mark. Okay. If we go on to item 3, which is basically about the council budget and the impact of the COVID expenditure and the loss of income and where we stand now. We've been through this a number of times where we've been told that the financial gap is just under £50 million, and we have to find a substantial amount of money for the next financial year in the region of £28 million. We've had the statements through from the Chancellor of Exchequer in terms of funding. I don't know if we've had further details in terms of the technical documents behind all of that, but it's over to you, Bassam, to give us an insight into what's going on and where we're at, and how much money we will be getting, because we spoke about many councils going under previously, and we also asked how close we were to be going under. So I'll let you respond, Bassam.
Thanks, Sigmund. So last month we went out on an engagement sort of roadshow on the comfort of our own laptops, but engaging with the public, with PBS organisations, talking about the position that we were in terms of the budget, and you'll be aware of the figures, of course, in terms of the gap both this financial year, which obviously we've been working to close, as well as the substantial gap that we still had for next financial year, and which point that we were sort of going out and conversing with people, it was sort of circa £28 million. Now we've obviously had the comprehensive spending review, we've had a one-year settlement come through on that, and clearly we don't know the exact figures yet, because we won't know that until a far later date. But the gap has closed considerably off the back of that, so that's the first bit of good news. There'll be a little bit less money as well because of to contribute towards TfL for the concessionary fares, because the date at which that was based on in terms of usage was in the middle of the summer, which obviously was somewhat down in terms of on the previous year, and obviously the Chancellor made it incredibly clear that he expected local authorities up and down the country to increase council tax by the maximum of 3%, 2%, yeah, and obviously the social care precept. So to take that in its entirety at 5%, and that was built into the figures that he announced on the day. So effectively, we know that that's something that the Chancellor and the government expect of every local authority up and down the country, to use that levy of 5% in our case, and in order to close that gap. Now, obviously, we're very close to where we will be in terms of having to announce, in terms of publishing the documents before, I think it's the 8th of February cabinet meeting, and so anything else that we'll be bringing forward, what we'll be doing is taking into consideration the feedback that we've got from the sessions that we've had, and also to feed that into the process in terms of closing the budget gap, and obviously publishing that in end of this month, start of next month, I guess. Yeah.
Okay, so you've obviously got finance to do some modelling. So give us the results of the modelling, please.
Well, you'll appreciate that I can't this evening give you the details of that, and obviously it's clearly those numbers anyway still need further verification, but we're not very far off that, Sigminder, so that's information that you'll see in the next couple of weeks, I guess. So yeah, 2 to 3 weeks.
Why wait a couple of weeks when we could have it now?
Patience is a virtue, Sigminder.
Not for me. Yes. Okay. Obviously, we've got concerns.
What I should say though is obviously, clearly, you'll see whatever is agreed in terms of for consideration as part of the proposals that we take to budget. I've committed as part of the sessions that we did in December to go back out and do further engagement session between the cabinet decision meeting and the full council decision meeting. Now, because of the mayoral decision-making process being somewhat delayed this year, we're probably going to have to move our full council meeting back by a week in order to accommodate that. But as I say, in terms of the actual details for next financial year, we'll be sharing that quite soon. What I would, of course, reiterate is that, again, it is sadly just a one-year stopgap. It effectively kicks the issue down the road. Potentially, so just kicking the can down the road to 22-23, and so we've just got to be conscious of that in terms of the decisions that we make this year.
Okay.
As well.
Okay, well, it would be really helpful to have a discussion when things get firmed up and that they're published. So I'll contact you, but obviously we wanted to raise the issue, which is everyone has been phenomenal. All council workers have been phenomenal, and Paul has been thanking people for all of their hard work under these circumstances, working on the front line, working from home, continuing to deliver wherever we are, valuable council services. So what we don't want to see is countless reorganisations and job losses and services being cut. So, you know, that's the bottom line for us. We want to safeguard employment and services, and we don't want to bear the brunt of it, and that's what we've always done, and we want to stop it.
Yeah, absolutely. I mean, look, you know, the start of this year, this time last year, I was very much hoping that this year would be that turnaround point where we were looking at actually potentially growth items. Clearly, we still have to build in growth items, particularly around children's services where there are significant, unfunded pressures in those areas and so on. So, you know, we're looking to put funding support for those areas going forward, so they're on a more stable footing. And what was interesting was, as you probably would hope, when we went out to the public and others, the feedback was very much that the top priority that they wanted us to achieve in our budget setting process was protecting the most vulnerable, and so that's something that we are looking to take on board in terms of our decision making process.
Thank you, Adam. You've been patient. Adam, did you have your hand up?
Sorry, apologies. Yeah, two questions. One is, as I'm given that you're indicating that the funding position might not be as dire as you previously thought, can you rule out all services making a 20% cut, which has been mooted as the worst case scenario? And the second question is, what is the position currently with the council's reserves?
Sure. So in terms of the first one, no, that's not something that was. I don't know where that's come from. To be honest, it's not anything we're not at that position. In terms of the reserves, we're in a position where we probably have to dip into those somewhat this year, and as we have done in previous years, and clearly we'd need to look at whether we could. If we did have to do that. The issue, of course, was with a bigger gap this year, as was initially thought, we would have to dip more into reserves, and then how would we try to recover that position, given that we need to build resilience in these most difficult of times. But it looks like, just sort of briefly, I guess we will probably tap into some of our reserves this year to balance those books. Not as much as we'd thought, obviously, earlier in the year. And we'll look at whether we're in a position to recover those, any of those sort of reserves next year or over a longer term.
Do you have a figure for the current reserves?
Well, we publish those in the in terms of the quarterly reports and so on, the quarterly monitoring reports and so on. But are you talking about reserves in general, or the reserves that effectively usable, or the general fund reserves, or?
Yeah, I mean both, but yeah, the ones that are obviously usable, particularly.
Yeah. So I don't know about to hand, but I can certainly.
If you can provide that to us.
Yeah, I can share that with you. Yeah.
Okay, thank you. So you said you haven't heard about the 20%, or you're claiming you don't have no knowledge about the 20%, but what about the 5% savings?
No, look. One thing I've been about Sigmund since it's sort of taken over this portfolio is about saying, look, we have a strategy about what we're trying to achieve. We have those principles that we've got, of course, through the Future Ealing. It's driven significant savings, so £50 million of savings through Future Ealing. We've attempted to do commercial savings wherever possible, because you would appreciate that if we can drive that, that protects the most vulnerable wherever possible as well. But actually, it's really about not just saying X% off the total budget, whether it's adults and children's, place, people, and any particular area, because actually each area has specific challenges. Each area is delivering different outcomes and so on. And it's really about how can we continue to deliver those outcomes, ideally, first and foremost, in a better way, costing less. And if we can't do that, then obviously we do need to look at savings in certain areas, but it's not as straightforward salami slicing, I guess, as being suggested by yourself or Adam in terms of one percentage figure or another.
Well, I think we should pick up on this outside of the meeting, and we should, particularly when we're talking about setting the budget for next year, we can talk about this in the whole. If that's okay.
Yeah.
Okay. Should we move on to the next item? Thank you for that. Should we move on to the next item, which is schools? Danny, would you like to kick off?
Thanks, everybody. Hi, can everyone hear me? Yeah.
Yes.
And thanks. I'm sorry that I'm a bit dark at the minute. The only place I can have this virtual meeting at the moment is in my room. So, first off, you'll be pleased to know I'm publishing my budget in 2 weeks as well, and I'm happy to share that with you all right now. I don't have any money, so there you go. It's a nice, easy one. Just a few points, really. To pick up from St Minda's point, within schools, we obviously are in a position where we don't want to see any restructures going on anytime soon. We thought that we had seen not an end, but nearly an end, to things a year or so ago in terms of the amount of restructures that we've had in schools over the past decade. And we're very keen that that doesn't happen again. So we are obviously talking with Ealing HR and individual schools, but we would like the council to make a clear message as a Labour authority to say that we do not want restructures within schools, and that as a council we will do what we can to support schools in this time and our members who are support staff, low paid, majority women, lots of people living in the borough of Ealing as well. So just to make that clear, I'm sure it's obvious to everybody, but we can't really repeat that enough. Our main job is to protect and preserve our members' employment. The second point is regarding clinically vulnerable and extremely vulnerable and the guidance that surrounds that. And I'm sure that we can all agree here that the government's guidance is not good enough really, but we're doing what we can within schools. We have been working with the local authority, HR, Judith, other people, Julie Lewis, and also the other unions, our sister union, the NEU and GMB, and as well as the head teacher unions, who I think we've had some done some good work with actually. However, for our members, obviously support staff within maintained schools are under NJC pay and conditions, and we know that the NJC has issued lots of guidance, and last year in March, particularly two dates, the 17th and the 23rd of March, guidance was issued about CB and CEV staff, the expectations on them, whether they should work at home or not, and those who are also living with people who are shielding. This time in this lockdown, the government hasn't issued the same advice, but the NJC guidance still stands, and it was reissued by the local government association, and we have asked for Ealing to send that out as part of the staffing guidance for schools, but unfortunately that has not been agreed to, and we're disappointed by that. St Minda and I were at a meeting earlier this week where we did push that, and we are writing two heads individually to do it, but obviously we want a consistent message. And what we're asking is nothing other than that Ealing as an employer makes the head teachers in schools aware that the NJC has this guidance, because that is really useful, not just for our members, but for everybody really. So that's quite important. So I don't know, Yvonne, if we could have a conversation, or whether you had anything to say, or whether Liz, you might be able to maybe speak with Mark regarding that. We have spoken to him, and I know that he's what he's done is he's noted what we've said, and that's not really good enough at the moment. That's what we want. We want a bit more than it to be noted. We want it to be acted upon. So thanks. I'm happy to pick that up outside the meeting as well. A couple of other bits very quickly. I don't want to take up too much of everybody's time. You'll be aware that obviously unions last week, before the lockdown was announced, issued guidance to members. Unison's advice to members was not that everybody in school should send a Section 44 letter, but that they had the right to work in a safe place, and we had a model letter that they could send along with their individual circumstances in it, and it achieved some success, and it's helped to protect members and schools and pupils. But what we would like is to obviously just point out that nobody should suffer detriment. We know that the union's advice has now changed regarding that letter because we're in a different position, but we don't want anybody to suffer detriment as a result of having sent that letter in. And there is one school in particular in which our member is potentially going to suffer detriment, or the school are considering that. Unfortunately, they don't buy into Ealing HR, but I think it would be useful, again, to talk to, well, the head teacher unions, but possibly Yvonne, you as well, if we can't get it resolved. Hopefully we can. We have another meeting tomorrow, but just wanted people to be aware of that. You know, we're not advising members to send these out without good reason. Vaccines, we're very grateful to hear that Ealing have been able to help lobby whoever they needed to, so that those staff working in special schools are going to be able to be eligible to receive the vaccine. And we understand that that is going to happen by the 15th of Feb. I'm wondering if anybody here at this meeting would be able to confirm that or give us an update as to the situation on it. But we welcome that, but we do want that for all staff working in schools, as Suk alluded to earlier. You know, there are lots of people for whom this vaccine is important. Well, everybody really, but you know what I mean. Lots of people are thinking that they should be at a certain point in the rolling out of the vaccine. I do think it's important that school staff have it, given that we're being told that we need to be at work, and that the government is still advising us that schools are safe. We really do need to have that, not just for those in special schools. We also welcome that our agency colleagues in the special schools are also eligible for the vaccine, which is great, because we have a number of agency staff working there. We'd also like those who are as and when to have the option of having that vaccine as well. Nurseries, you'll probably be aware what happened last week was last Thursday. The government seemed to like doing things late on Thursday. They announced that the maintained nurseries should be open fully to all pupils, which was an outrageous decision and caused a lot of upset amongst all education staff really, and unions within Ealing and nationally, because there'd been no negotiation, there'd been no consultation on that. But there's a huge problem that nurseries face at this time, and it would be remiss of me not to point that out now and ask us as an authority to stand up to this. Otherwise we face losing those nurseries. The funding that they stand to lose, because they're funded differently to schools generally, you'll probably all be aware of it. I don't know, it's a bit confusing, but anyway, the maintained nursery, they'll only get the money if the pupils are in. If the pupils are not in, then they won't. And so we do face losing maintained nurseries for good. And private nurseries could also suffer as a result of this, and then that would just not be right. So I think we need to do a lot of work on protecting our nurseries, helping those nurseries to understand that they shouldn't be forced at the moment to have all pupils in, because we know that wouldn't be safe. That's 30 children in a nursery, in one nursery class, and then that's lots of people to staff that class. We're supposed to be in a lockdown where we're staying at home, basically. In terms of testing, we welcome that school staff are going to be able to use and access the testing sites across the borough. That's really good news. I think we need to work on a way of communicating that. I know it did go out through EGFL, which is very good. But again, lots of our members won't check their emails in quite the same way as maybe teaching staff would. And also, some will not have access to emails. So it's just about getting that message out. Obviously, we're advising our members that that's the case for Ealing. But I think it would be great just to hear how you as an authority are going to try and get that message to people. Because as I said, a lot of our members in Ealing schools also are residents of Ealing. So it's just about getting that message out there. they're the general points that I had really, and I know some of that was just me speaking rather than asking any questions. We still think there are too many people in schools at the moment. We know that Ealing as a council on its own can't necessarily change that, but we would urge you to work with us and work with other London councils to make sure that schools are supported in the decisions they make, because a lot of schools are trying very hard, you know, not to have too many numbers, but they're balancing that with knowing that their children may not be safe if they don't come in. So I think it would be good to consider how we can, as an authority, support those pupils without putting all of that on schools, because we can't, you know, there's only so much that we can do, and we can't be social workers all the time, and we can't, you know, we can't make decisions solely because we think that if they don't come into school, they won't be safe. It's really difficult, and I know it's not an easy one to answer, but I think I said it the last few meetings. We do feel as if we're at breaking point, and you know, there are lots of people who don't feel safe going in, and they're living with people who are vulnerable, and it's a really difficult time. And we just wanted to put that message across really on their behalf. They don't want to clap or anything. We just want to try and support our pupils and our members as much as possible. So they're the main points I had really, and of the 2 or 3 things I was asking about. Liz and Yvonne, perhaps we can pick those points up. And thanks.
Thank you, Danny. Well put, and we're fully behind you. Agree with everything you've said. Yvonne, since
Yes.
this is your mandate, isn't it? So
Yes,
let's have a response.
all the things that Danny has mentioned, we have been discussing over the past week or so. In fact, Ealing schools only under 10% of the school population has been going in, and about 30% of children with education care plans. So, in fact, our schools are not as full as some of the other London schools, but we're monitoring that all the time, looking at those figures. Talking about vulnerable people, yes, of course, we've said this before, I think, to Danny, that we will look at things on case by case exceptions. I know some schools have been more reasonable about letting people work from home, and as Danny says, other schools have not been so good about that, because if they're doing remote learning, you don't really need to have all the staff in the actual school, because they can do that from home. So some schools have been less reasonable with their staff than others, and we can certainly do that case by case. And we've certainly been looking at all sorts of things. He's quite correct about the nurseries. If the children aren't there, then of course the nurseries won't have the money, and we're discussing that at the moment as well. The guidance that he was talking about, I think HR and Mark Nelson has pointed out that the guidance is a bit contradictory as well. But again, we'll look at case by case issues. And I've been discussing lots of these things with Judith and with the NEU, and I'm happy to take up things outside this meeting, because if we went through each one of those, we'd be here for the rest of the meeting. But we are aware of all of those, and I know Julian is as well. And we don't want, it's quite true that special schools, we are hoping that the staff there will get their vaccinations first, because there's been some spare vaccinations that weren't used, and they were directed to special schools, and we want to have all the schools staff tested eventually. But I'll leave it there, because I can take up some of these things outside this.
Okay, so perhaps we can meet next week, Yvonne, subject to your diary, and we can have a discussion to take these things
the week
forward.
After next would be better, if that's possible.
Okay, the week after next. Okay, that'll be good. I'll arrange that for Danny and I to meet with you. But I just want to enforce, it's a fundamental point of principle that the LGA, forget about the government advice on CEVs, LGA and Unison are still stating that the circulars that were issued on the 17th and 23rd of March for clinically vulnerable staff still apply. And I've had a brief discussion with Liz about this in terms of the council staff, and the council has in general been very flexible, and so the staff, so there doesn't appear to be major issues. But within schools, they've got to be told that NJC LGA, they still cover schools and the staff, the support staff that work within schools. So that's a message that they need to know. And
no, I know,
we need
but
to have
it's
that
a tiny bit
flexibility.
more difficult because you can't have a school without a caretaker, if you know what I mean. So it's slightly more complicated, but we will look at the things case by case. And some schools have been very good. I mean, for example, I know a school in Acton where none of the office staff are in at all because of reasons that you outlined, and the teachers are just taking it in turns to answer the phone because they know that the staff can't come in. But some schools have been less sympathetic, but I'm happy to take all these things up with you outside, if that's all right.
All right, thank you. Julian, you've got your hand up.
Yeah, just quickly to reassure everybody that all of those things that Danny brought up, we are collectively lobbying as London councils, and more so as London Labour councils as well. Yeah, we are very mindful of everything that you're saying, Danny.
Thank you. So can I come back just on?
Yes, of course you can.
Thank you. Cheers.
Yeah.
I can't raise my hand on the Zoom, so that's why I've done that. Apologies.
Yeah.
Just a couple of points. Thanks, Yvonne. I suppose it would be best to pick those up at a separate meeting, absolutely. But just on a couple of points, when you say that obviously you as Ealing are hopeful that special school staff are going to get the vaccine, I just wondered exactly if you could clarify, because from what we've been told, I work in a special school, so I've had an email from our head teacher. They are happening, so I'm just wondering if the word hopeful means that it might not happen, or
no, you're right. Some schools have had them, and that's the aim. That is the aim. Yes.
Okay. All right. Okay. Brilliant. Just to
no, that's correct. No, we're doing that at the moment. Yes.
And then finally, Julian and Yvonne, I don't know if you would do this now, but we would really like you as the council to issue that notice to schools that they really should not be having restructures during this time. And I know that the council's budget is limited until we find out what Bassam's got hidden away there, but that also schools should be supported in trying to set, deficit budgets. I know that doesn't solve problems, but we can't make people redundant during this time. It's just morally wrong. So I really would hope that you can put the strongest message you can out, please, to schools and to your residents that we're not going to have to go through this as on top of the pandemic. Thank you.
As you know, Danny, sorry to come back in, budgets are in the remit of the governing body. And so we wouldn't encourage anyone to be restructuring at the moment, but that will be down to a governing body, and they'll get their indicative budgets fairly soon, sort of February, March. So hopefully they shouldn't be, but it's always difficult. And certainly that's something I can discuss with Julie and others, but I'll take that away.
Thank you. Let's move on to the next item, which is inequality. And we said we'd take this with item 8 of the main agenda, which is workforce equality update. Liz, would you like to introduce and give us a feedback in terms of what's been happening?
So of course. So as you're aware, we've got an inequalities officer group at the moment, due to meet again next Tuesday, which Julian and the chief executive are involved in and running with us. So there's a lot of work underway in terms of the workforce, and the updates have been going to that group. What I would say is that, as you know, we've had consultants supporting us on a big equality audit across the organisation. And with that piece of work, we've got the meeting, the whole of the leadership forum, which is about 100 people next week. They've met with all the directors now with some initial feedback and to try and agree with directors what are the sorts of things they might need to be thinking about doing in terms of their personal responsibilities. All that work will come together at the end of January in a report back to us from the consultants, and we'll be able to start implementing and agreeing what we can implement whilst we're in lockdown at the moment and everything else. As you're aware from conversations we've had, some of the things are underway already, and one of the big focuses is about recruitment. So we've already started all the agency and permanent recruitment is now reviewed by myself and the business partners before it all goes out. So where staff have said that, you know, opportunities aren't there because we always go out to an agency person or an interim or something else, we're looking at all those opportunities now and making sure they're advertised internally before they go external as well. Unless it's a very specialist post where we know that, you know, there might be the odd specialist post where we might not do that. For example, if we needed a social worker, it's unlikely we're going to get lots of internal applicants for it. So lots of work on that at the moment, and happy to catch up outside the meeting. If I just talk about the health, safety and wellbeing item at the same time. And just to note that the data around inequalities is also something those consultants are reviewing. So how we present our data and what data we monitor, that is also part of their work. On health and safety and wellbeing, you're aware we've done a number of wellbeing surveys to date. We're due to do another one at the end of January, which we'll be engaging with the trade unions on in terms of some of the questions, how we might tweak them. We felt that the end of January, particularly with the circumstances we're in, would be a good time to get some feedback from the workforce about how things are, what support we're giving. And we continue to update all our wellbeing support, and in particular, big push on at the moment in terms of promoting. I've sent out an all manager email today promoting things that need to happen. So we have an increase in sickness absence on in terms of COVID. So we're re-promoting what do managers need to do, what support do we need to give people, and making sure we monitor that on a daily basis at the moment, because alongside everyone else, cases are going to increase. So testing for staff, big thing for all of us. So a number of us have already been for our test in Percival House when we've been in there, and we're really, really keen that those staff that are available to either in Percival House or out and about, agency, permanent, interims, whoever they are, should take up those opportunities. So every conversation's been, have you been for a test yet? And do you think you should be doing that? I think it's really important. And I hear what Danny said about, you know, testing, getting the message out to school staff. So I'll try and pick up with Mark about what more can we do to encourage, you know, school staff are welcome to come into any of the centres and have their tests as well. We did have a wellbeing speaker back before Christmas that joined one of Paul's briefing sessions who did an exceptionally good piece of work. We've just published on the intranet, so any staff can access that session that he did about, and it was about looking after your mental well-being basically. So that was a good piece of work just before Christmas. So is there any specifics you'd like to pick up perhaps?
Should we split them up, and are there any comments or contributions in terms of the inequality stroke workforce equality update?
Yeah, can I comment?
Yeah, of course you can, Mary.
Yeah, so I suppose there's an element of I feel like we take a couple of steps forwards and then we take some steps backwards, and to me they are some quick wins, and we need to start learning quickly and not keep doing the same errors. So from an inequality point of view is, so the council went that extra mile, you'd think, and created the Recognition and Appreciation Day, which we were all consulted about and we thought was a very good, positive message. But one of the groups of staff who are, as somebody said in the inequalities meeting that we had the other month, digitally excluded, and this is a group of staff who are digitally excluded because Ealing will not provide them with email addresses, which I think is appalling. But anyway, this is a group of staff who have worked all the way through. They are the housing caretakers, and I'll name them because I just think they are some of our lowest paid workers, and they deserve that day more than a lot of other people deserve that day. And they got told about that day on the Monday before the Christmas Eve. So only 3 days prior to that day. And then they were told that management has decided the way that you are going to have your day is you're going to get half a day on Christmas Eve, and we'll think about when we can allocate you to take the other half day in January. And that is appalling. So if you are a very senior officer, you were allowed to have a day. You could either have Christmas Eve or you could pick another day that you wanted. If you are the lowest paid workers, you get treated unequally by this council. And that is really clear evidence to me that we are not learning from all of the things that we keep raising about inequalities. And there are some quick wins, and that isn't, because they are not being treated fairly. So that's for my, I really want to see progress. And you know that because I've been part of the inequalities group. I've really encouraged everybody to get along to those groups and express their views. But for then that to happen to this group of staff whose voices are not heard, nobody ever hears them because they don't get any communications, or what communications they have is second, third, fourth hand, whatever the team leader thinks it is important to say to them. And so going on from that, they don't know about the lateral testing. They still don't know about the lateral flow testing. I've spoken to them today and they went, what are you talking about? And everything. So again, how is that message going to get out? How are you going to ensure that those groups of staff actually do have access to that? Because I don't believe at the process that we're going through at the moment that we're actually going to get that message out to that group. I'll come on and talk about well-being and mental health in a minute.
Okay.
So Mary, Mary, I know you've raised this with me in an email this week, and unfortunately I've been caught up in testing centre setup, but I will pick it up with service. I don't find it acceptable that they were asked to take our appreciation day in 2 hits like that. So I will be dealing with that this week. Hopefully I can get hold of someone tomorrow. And on the communication front, until we resolve the issue about the email accounts, to be quite honest, I do think we start. Not that it's a preferred option. We need to write to people direct. They are not the only people, though, in spite of the communications that haven't in the workforce that haven't. Even those with email accounts don't seem to have picked up the fact that about the testing and got the message. I know we've done it really, really quickly. So I think in terms of communications, probably we need to write to those people that don't have the email accounts, get a letter out to them, and I can talk to the service about that. And there will be another group of people as well as the caretakers that again don't, some of the cleaners, etc., that don't have those email accounts. So you and I both know that we've got more than the caretakers that we need to deal with. But I don't disagree with anything you've said, Mary. I think the answer is we're going to have to start writing to some of these people direct while we resolve some of the issues. So it might be that we need to do a bulletin that goes out from HR, even if that's what's needed. My team will take that on.
Thank you, Liz. Should we move on to your issues in terms of health and safety, Mary?
Yeah. So again, unfortunately, I'm not happy, Bunny, about something, and so I just wanted to tell you what has happened this week in an example of where I don't think that managers are on the ball about COVID and the rapid spread of COVID. So we have had a very significant, and not everybody might not know this, but you've had a very, very significant outbreak of COVID in a staff group, which is, and I will name them because it's easier for you to understand. It's the Careline staff group, who are a group of staff who are not able to work from home. They are not able to socially distance. We have done, I've spent a lot of time, 9 months ago, we spent a lot of time trying to work out how we could make their work environment safe. And we did do things. It's really unfortunate that on Sunday, a member of staff left the office having worked all weekend and been in contact with 7 or 8 different members of staff who come and go for different shift patterns over that period, went home feeling unwell and tested positive on Tuesday. She informed her manager on the Monday that she was not feeling well. And this manager did not ring all the staff that she had been in contact with and insist that they all immediately went into self-isolation. That's clearly what the government public health advice is, that you must go immediately into self-isolation. The staff were told to have their lateral flow tests, and if they tested negative, to come into work. That is not what the government advice says. It is appalling. That has now rumbled on, but we have, and I haven't heard the latest today because I think that the staff didn't tell me anything more. But yesterday we had 2 positives in that team, and we have 4 other members of staff with symptoms, all waiting for their tests. Some of them had had their lateral flow test and they came back negative, and they're now showing symptoms. So they've gone back for the full test. And we've got a situation where that service has actually had to be restricted, and you now do not have a full service operational because you don't have enough staff left to run. Now, I don't like almost dobbing people in, but the agency staff were saying, and I can believe that they were saying them because I know quite a few of them, they were saying, I am not going for a test and I am going to continue to come to work because I will not get paid if I isolate. So there were people cross-infecting each other all over the place. Now, if that has expanded from 6 people being affected to more, then we really have got a serious problem, because it was not jumped on immediately. It was not dealt with. And the effect that that's having on people is that not only have we got a COVID situation, we have got an anxiety issue now, because you've got these staff that are being pressurised who are not part of the group that worked at the weekend to be in the office. The other thing is that apparently FM took nearly 48 hours to do the clean in the office. I don't understand that. I haven't got to the bottom of why that is. They should have been in there immediately. It's a priority. It is not, they can be put on the list. They couldn't work anywhere else. This is it. And we just need to do a lessons learned from this. But emotionally, this is really going to hit this group. I feel still really, I never usually feel like this, but yesterday evening, I just felt, what on earth is happening to this group of 18 staff, 2 who are not working because they're in the clinically extremely vulnerable group, but the other 16 are just being exposed and nobody is getting a hand on it. And it took far too long. All of this should have happened on Monday morning when that member of staff said, I have got symptoms and things like that. And we'd waited until Wednesday evening before action was taken. And it's just not acceptable. And we need to learn from this.
Shall I respond, Mary? I agree with you. It's not at all acceptable. And actually, we've got a similar situation with another staff group at the moment. Hence my sending out the guidance to managers again today. And I've already spoken to Ed about making sure that when there's an issue that the team jump on it a bit more quickly, as in they should have done it the same day. Unfortunately, not making excuses, but they were busy trying to set up the testing centre. So I think that was a resource issue their end. But I don't think people understand the seriousness of dealing with this quickly. What I would say is, and I will make sure that the message is conveyed, that the agency staff will be paid to self-isolate. That was our agreement at the outset last March. That continues to be our agreement. If we have agency staff working for us and they have to self-isolate, they continue to get paid, Mary.
That message was definitely not out there because they don't know.
Yeah.
anything?
No. Well, they might not know that, but I'll pick that up as well tomorrow. I'll pick that up with the team tomorrow to make sure that that's clear. Yeah, colleagues and I talked about, we've got another situation as well, and we talked about it today, hence my email out, because people are just, we've got a very clear process. We've communicated it numerous times, and people management need to take it seriously. They do need to take this really seriously and make sure that we jump on things much more quickly.
Thank you.
Yeah.
You're on mute, Sukminder.
Sorry, thank you, Mary. I was going to say, Liz, your flowchart, you sent that email out in December, yeah, because I saw it and I saw the flowchart, and it's very simple. It gives you a step-by-step approach in terms of what to do. Now, if managers are not complying with this, then they need to be taken to task. It's quite straightforwardly. It's not a case of this slipped through the net or whatever. This is serious. This is potentially deadly, and we've got to adhere to both the government guidance, but equally our own clear guidance. And what is it with these managers? Can't they read?
I like to think when we recruited them, they could.
So I think people at the higher echelons need to have a word with these managers, and to get the message out very clearly that this is unacceptable. It won't be tolerated. If this happens again, there's going to be big trouble.
Well, I think probably I need to personally write to the people involved, because the other situation we have, I had to ask the question, did we have any contractors in that place as well? And it seems like we didn't alert our contractor as well, who's also visited the site, who has been elsewhere as a result of it. So to be quite honest, I think it's they're all going to end up having to be, I'll have to write to them all individually. The message doesn't seem to be getting out, and I'll raise it with Paul. We've got a gold meeting tomorrow, an SLT gold meeting, so Julian and I, we can raise that at the meeting tomorrow about the seriousness of it all and people taking swift action.
I'd welcome some feedback from that, Liz, that discussion as well, because the thing is that we need to legislate that this doesn't occur again.
Yeah, all the consequences where those people don't do it. Yeah,
indeed. Thank you. Shall we move on to the next item, which is any other issues relating to COVID-19 and any other related issues? And we have dealt with the ethical care charter. It's this issue about confirmation that from the members that when we are letting out contracts, that there is an absolute requirement that they have to implement the London living wage as part of that letting out of the contract. Do you want to come back?
Yes,
on this,
that is our.
right.
We did pass that in council quite some time ago, and we take that into consideration on renewing any contracts, Sukminder.
Okay, and
we do that.
Does that also extend to us stating to schools that they have to do the same thing as well?
We can't actually dictate to schools to do that because, as you know, their budgets are under them. We would recommend that they did it. I mean, I couldn't see why they shouldn't, because it would be the non-teaching staff again who might get hit, but they should do it. And I certainly know that when we recommended this a few years ago, when we did adopt the London living wage, and as a result, some schools did up a lot of their non-teaching staff. They did take notice of that. Some schools didn't, and they were academies, and we couldn't do anything about it.
Okay, well, we may. Okay, well, thank you for that. We may email you with an issue of concern potentially for a school that has a catering contract, which is going out to a third party. So we might come back to you on that. Okay. Danny, you've got your hand up.
Thanks. So, yeah, it's just on that point actually, and then really you just said it. So, but it's not just one school; it's a group. It's the school's catering contract, and it was tendered by Ealing. So Ealing is providing that service to schools. And also when you say, Yvonne, that you can't make schools pay the London Living Wage, I understand to a point, but remember that in maintained schools, our staff are under an Ealing contract as well.
I'll certainly take that away and have a look at it. I know the contract was not re-tendered because of COVID, but I'll certainly go away and check that and get back to you.
Thanks, Yvonne.
Okay.
Yeah, it was put back a year, so it's going to happen now. It was going to be last June, but it's going to be this June.
I'll look into that for you. Yes, I will.
Okay. Thank you, Mary. You've got your hand up.
What? Yeah, I hate to say this, but I feel that we need to be 100% firmer about this, because the school contract, the school meals contract, is an Ealing contract that all of the schools buy into. So, Yvonne, unfortunately, if this new contract, which I believe is let, it has just been delayed for implementation. I believe all the finances have all been worked out, but we have not been shared with that. As far as we're concerned, that contract has to be based on the bare minimum of London Living Wage, because if not, you have not stuck by what you have indicated that you are going to do. And the previous contract, Harrison's, who are on their last, 6 months or whatever with Ealing, did not pay London Living Wage. And so the new contract will have to be a significant difference. And we want to make sure that that is. And let's not leave it to when we get to the 2P consultation, which we will have to go through in the summer for lots of staff, because there's lots of people that use that contract and everything. And that, we're going to be very disappointed when we get there and discover if that hasn't already been written into the contract that they've got to pay London Living Wage.
I'll certainly go away and check that. I couldn't say, one way or the other, but I'll check it, certainly.
Okay, well, thank you. Shall we move on to the main agenda item 7, which is non-standard workers report? Are you doing this, Liz, or is it Andrew?
I'm happy to do this.
Thank you, Andrew.
Yeah. Okay, thank you, everyone. So this is the usual update report, and with a bit more information that you asked for at the last meeting. It's still work in progress. There's still further work that we need to do, and we know that. But as of January 2021, there are 10 schools funded and 93.3 corporately funded interims and consultants, respectively. And the appendix to the report has got the more detailed information. And then looking at Adecco agency workers, as of September 2020, there were 507 agency workers, and that was costing £1,900,000 per month. So if you take that 1,900 and multiply by 12, the annual cost of that Adecco contract over a 12-month period is £23 million. With regard to the interims and consultants, in the current financial year to date, the council has spent circa 0.556 million on consultants through payroll. You asked the last meeting if you could have that updated information. The work in progress is that there's a further 42 consultants who provide their services, and we're doing additional detailed analysis to establish the accurate spend. As I say, that is work in progress, and it won't be completed until the end of the financial year. So it won't be ready in time for the next meeting of this committee, which is on the 3rd of March. But it's, we are doing that work, and we're committed with colleagues in finance to do that work. So with that in a nutshell is the report.
Okay.
Can I just add to that?
Yes, of course you can, Liz. Go ahead.
Sorry, before you come in, if that's all right. So there is a line-by-line review has started on the Adecco agency assignment. So work was done by services before Christmas, and due to lots of competing pressures, as well as looking at other savings. That work has not been completed, so we have an agreed deadline to review all that in terms of not who we've got on the Adecco contract. We know who they are, but are the gradings correct? Are the opportunities to move them on to where it's cheaper fixed term contracts? You know, all those things. Why have we got some that have been here still long? So that piece of work has started, because we do believe that might create some opportunities for some budget efficiencies in next year. So that piece of work's underway. Piece of work Andrew mentioned about the consultants that we don't have the financials for at the moment, that's because they're paid through Business World, and it's been a bit of a struggle, to be quite honest, to track down who's who on where they are on Business World. People trade in different names. So that's the piece of work we're undertaking as well. Once we've established that baseline and day rates, we'll be applying the similar principle to that group of staff as well, in terms of those are the day rates, how are they funded, is it project, is it limited time, and where's the opportunity to negotiate those rates or put people on, if necessary, on other contracts. So that's the agreement I've got with the Chief Finance Officer to do that piece of work.
Thank you. Just some observations, which is the spend that we have on Adecco agency staff, just under £23.5 million, is shocking, obviously, and we welcome the work you're doing there in terms of trying to get people onto contract, which would be better, and also using these posts available, making them available for redeployees. But you know, in light of we're spending just shy of £23.5 million here, yet we've just gone through a reorganisations. And we're going through the results of that in terms of people who are on notice, and we need to ensure those people are not made redundant as a result, compulsorily redundant as a result of those reorganisations. So we really need to have a big handle on this. I note your comments that we are trying to find out what's on Business World, because there were a lot of to follows on the attachment, and I was thinking, well, how long is it going to take to follow? It's what I was wondering. But you've answered that, and you are drilling down. I'll open it up to my colleagues to ask questions. Mary, you have your hand up.
Well, yeah, because straight away I'm thinking, you know, like we just talked about, you know, that for a lot of our permanent staff, we don't have really good communication methods to them. And I know the main reason why those several groups of staff that we've mentioned today who don't have email accounts, it's all down to cost and things like that. So we could just take £1 million out of that agency thing and spend it on actually supporting our staff who actually do work for Ealing, because that's an appalling amount of money that we are spending on interims. So I was thinking from a BASM point of view. So what do you think the staffing budget is for the council as a whole? And then how much of that 23 million, what percentage is that on the whole staffing budget? And is all of these staff who have been funded either by the Adecco, either through the consultants, or this missing group, which I guess is another £500,000 or £1 million, whatever it is, expect it's even more, because these consultants are the ones that are earning the big money and things like that. How much of a percentage is our workforce in this thing, but it's costing you more money? An example, let's go to the Careline staff. I know that those agency staff, some of them cost more than our permanent staff, and they've been here for 10 and 14 years, but they get better rates of pay than our staff do on their agency contracts and things like that. And we've been wasting money all this time and not dealing with filling these posts permanently and things. And we know also that a lot of agency staff want to be agency staff because they like it. And we need to be dealing with that issue. And then you need to be making permanent roles, or you go and work for somebody else. We can't have this situation just going on forever and ever and ever.
Thank you. Does anyone else want to comment? I dare say no. Bassam, did you want to come back in terms of the percentage of this the spend in comparison to the total spend of staffing?
I'm assuming it's a rhetorical question and Mary has the answer and would like to share it. But I think the point...
You.
I don't. It's not one of those things. I honestly, genuinely don't know. I would like to know.
Sure. Yeah, I'm sure we can. I mean, what I can say is that we've got obviously a review that is underway in terms of looking at all of those sorts of issues. And I completely appreciate where you're coming from, Mary, in terms of the sorts of cases that you're talking about. And clearly, you know, as we look to make those financial savings, it's also about the sort of, you know, the fairness aspect as well. I'd appreciate some of this is driven by the market and in terms of making sure that we've got, you know, the right caliber of staff. Some of these challenges, for example, have been around health and safety, off the back of the deadly situation that happened at Grenfell, for example, where the market forces, sadly, from an industry that was so woeful in dealing with the situation in the first place, and then effectively raise the cost of having to deal with the issues that they've caused in the first place. But that isn't obviously the majority of those roles, but we will obviously be reviewing those and coming back with some proposals, as Liz has referred to that, and we're always looking at making sure that in terms of savings, we look at managerial, and more senior managerial positions as well as so sort of looking slightly outside of this, as well as anything that would impact on frontline staff. So that element of fairness, protecting the most vulnerable, those are the sort of principles that direct us in terms of what we're doing. I do appreciate sometimes, and obviously we've still got that mechanism in place. Any of those new consultancies or consultants and so on have to be signed off with an appropriate business case and from my point of view, the funding that sits behind it by myself and Julian, and so we still have an eye on that. But as you pointed out, Mary, some of those will have been historic and have been there for a long time, so that's part of what we'll review.
Thank you. Anyone else? Mary, is that a legacy hand or did you want to come back?
Yeah, no, it is a legacy hand, but Kemi's got a hand up.
Okay. Right, Kemi.
Hi, yeah. I'm sorry, but I just need to ask this question. Why has it taken this long to do this review? Because I know for a fact Ewan has been asking, about this for a very, very long time. Why is it taking this long? That's my question, really. It's just
okay. Thank you. I think it's a valid question. Thank you. Liz, do you want to come back on this?
Yeah. This is not the first review of the data. This data has gone out to the directors on more than one occasion. The agency information has gone out to the directors and service heads on more than one occasion for asking them to review and look for opportunities to reduce it. It is not within the gift of my role to force them to do this. However, Ross, our Chief Finance Officer, and I have had that discussion, and we're going to put in place a reporting mechanism through one of the boards that he and I both sit on to make sure that there is no reason for them not to review it. What I would say is, in terms of some of our interims and consultants and some of our agency staff, they are now indicating, and I think this is probably as a result of COVID. I have health and safety interims in my area, agency staff, and I've already said to them that this year they either come onto a proper contract or we won't be continuing to work together. And actually, I think in this current environment that we're now dealing with, these very difficult circumstances, we are going to see more of them willing to move into a better position. I think services are concerned because when the agency people push back and say, well, actually, I'll just go and work for Hounslow or Brent or whoever it is, they're concerned they're going to lose the resource and the impact on their team members as well that are permanent. So, but I do see a change of direction. We started to see that before Christmas, and I think with what the situation we're currently in, we will continue to see more willingness for people to move on to, you know, equitable terms and conditions as the permanent workforce.
Okay, thank you for that, Liz. Julian and Bassam, could you also provide support and intervene to get the directors to provide the information that they must provide, not simply Liz asking for the information and them not responding? Can we agree with that?
I mean, I think it's something myself and Julian will pick up with the cabinet, so that each cabinet lead raises it with their relevant directors, because it's a political drive as well as
perfect
from officers. Yeah.
That's helpful. And whilst you're still on the line, I've got Mary and Adam that want to speak, but can I, it's just something that you said in terms of directors and what's happening and the funding for posts that you're reviewing and you have to give approval to. Can I just highlight our concern, which is what we understand that there may be some senior posts which may be coming forward to be created, some AD posts and team leader posts, and we're very concerned because remember we've had this long and torturous discussion about delayering and not cutting at the front line. It seems as though we are going down a route of relayering again after all of these discussions. So I'd welcome a discussion outside of this meeting. But Adam, would you like to go first?
Yeah, just briefly, just to follow up on Liz's point, I think there's clearly an opportunity to put some agency staff onto fixed term contracts and some agency staff actually asking to go onto fixed term contracts, and we should seek and encourage that wherever we can, because I think that would provide an immediate control on the spending, reduction of the spending we're currently making, and something we could do quite quickly.
Thank you. Mary.
Yeah, mine was really different, actually. And sorry, I should have raised this a bit earlier, but I just thought because we're in AOB at the moment, is that I hope that the Julian and the other councillors would like to get a message out to their the residents of the borough about observing how they interact with staff members at the moment, because that was another issue that has been raised from staff who are out there working in the community, about residents were really good at the beginning last March about understanding social distancing and things, and they seem to have lost a lot of that. Coming out of lifts in housing blocks and there'll be 6 people in a lift and not the one person as they should be. And I've asked housing to get messages out, but I've been told we're not due a newsletter for another 3 months. So I was wondering whether you could do it via your blogging and your communications with your residents to remind them that, the staff are trying to do their jobs and trying to be kept safe, and they're not being rude when they're saying, will you please walk away from me? Will you please give me some space and things? So sorry, I meant to mention it earlier. So
Okay. Just picking up on Adam's point before you come in, Julian, it's a valid point of the moving agency staff or offering them fixed term contracts. I'm sure we'll be discussing that in HRTU meetings, Liz. So I didn't want to lose that point. But Mary, you've also got a valid point in terms of keeping staff and members of the public and council tenants safe. And I see Julian's upside down now, so... Oh, you've gone to your side now. Go ahead, Julian. You can still talk. Okay.
Sorry. My phone's doing all kinds of strange things tonight. Yeah, happy to take that up, Mary, and I'll see how I can weave that into my kind of weekly message. But it's a very, very valid point.
Can I come in very quickly just to say that also, if you can remind members of the public regarding school staff as well, just in terms of trying to be respectful. when dropping off pupils and things like that, because we've had a rise.
Yeah, no, of course.
Thanks,
Yeah.
thanks, Julian.
Okay, thank you. I think we've covered the whole agenda and more today, and I think it's been very helpful. So the date of the next meeting is the 3rd of March. I think we have covered everything, and I just like to say thank you and keep safe. And
Minda, can we go back to Teams? It was much easier.
Thanks, Amanda.
Yes. Can we agree? Can we all vote? Put your
Teams,
vote
please.
up. Just say
Teams.
Put your
Teams.
put your hat.
It took me 10
Say
minutes
yes.
to get on here. Yeah, not rock.
Can we have Teams back? Because their sound
Okay.
wasn't so good. Thank you,
No.
Minda.
Okay, thank you. We'll talk
Bye.
to Helen Harris.
Yeah. Thank you.
Bye, everybody.
Thank you.
Take
Good
care.
night, everyone.
Bye.
Keep safe.
Thanks, Amanda. Thanks, everybody.
Thank you.
Bye.
Bye-bye.
Bye.
Bye. Thank you, Keith.
Okay.